What's good, y'all? Welcome to another Anything by Mansa Cannon. I'm Mansa, and today I have an amazing woman on that I'm extremely excited to allow her story to be shared with you, as well as for you to understand how you can do what she does. And what does she do? She is not only a nurse practitioner, she is a major of a medical unit in the military. She's done amazing things throughout her life, and honestly, I know a lot of people who desire to have her position, but can't figure out exactly how to do it. And today I want to make sure that we iron out exactly how you can be a nurse practitioner. And let's also learn a little bit about what it's like to do her role in the military as well. So without further ado, how's it going, Miss Dorian?
It's going wonderful. Thank you for having me.
I appreciate you. I appreciate you. And I do want to repeat what I said, Miss Major Dorian Marsh. With that, I got to ask the first and most important question that allows me to have you, which is, do you like your job?
I absolutely love what I do. I don't wake up a single day and dread going to work, which I think is a good thing. It's not the status quo much anymore. Some people wake up and they don't want to get ready for work and they find a reason to not make it there. But I love going. I have to make myself come home, actually, at the end of the day.
That's a good and a bad thing that I fully understand. That's that part of work-life balance, and at the same time, you get immersed in your work. Yeah, I fully understand it. That's interesting, and I'm sure we might have to bring that up at some point just to see how you manage it. Okay. But you're when it comes to your education and from high school to college, did you go straight into the military, or was there a segue?
So for me, the way our family typically operates is they want you to go straight to college out of high school. They really push secondary education like higher. And that was my plan. I went to the University of Dayton. I had a plan to go to school and be a biologist. And so I went for 2 years before I joined the military.
Okay. Well, before we get all the way there, I got to ask one of the questions that everybody's used to me asking, which is, what is the first job that you ever remember wanting to have? And the answer can be ridiculous.
No, my very first job I wanted to be a biochemist. From the time I was a child, I had one aunt that I really looked up to, and she always told me, you could be anything you want to be. You're going to find the cure for cancer. You're so smart. So bam, there it was. I was going to be a biochemist in a lab somewhere cooking up the cure for cancer. So science was always, from a young girl, a part of who I was going to be.
Anybody out there that's listening, I have to take a quick caveat because you just highlighted a significant portion, because I have to go back and dig into that, because the reason this whole thing is called anything ... is because it's to counter that conversation of you can be anything you want when you grow up. Mm-hmm. And oftentimes anything literally is nothing because it's not an actual position. You're not telling me anything. But it sounds like your aunt said, you can do this, you can cure cancer, and she implanted that thought in your head. She gave you the ... is finish the sentence. She finished the sentence.
Yeah, like a direction versus being so vague and open.
Yeah, and it allowed you not to just have a vague idea, but an actual direction, and that direction clearly has led you down a path. Did you know anything about that prior to her saying this?
Oh no, this could have been a time where I was 7 or 8. I was in school and they sent a letter home. You know, back in the day, they used to pin letters on your back when they sent you home. They didn't mail it or email it. So I came home with the letter pinned on my back. I had no idea what it said. And that letter told my parents that I was gifted and that I was above average in everything, every subject that was at that school. I still remember this to that day.
Okay. And so since you were 7, you wanted to do this. Was there any veer-offs and you started having ideas about other positions, or was this always and only the idea?
For me, no, always something science, something in a lab though. I did not want to work with people. I only wanted to work inside a small space by myself, researching, finding something that was going to help humankind in the long run.
Okay. All right. Well, one of the things I've recently started to do, because I'm so excited about this, and I think there's so many different conversations in your field that I want to allow people to truly get an understanding of what it looks like to do your job, that let's go ahead and just breeze through all of the roles that you've done, as well as exactly how you become a nurse practitioner, as well as commander of the medical unit in the military. Let's go ahead and just dive into that so we can get into the other questions, because I've dealt with a doctor and that interview went too long because he was excited, I was excited, and so much was coming out. And yeah, let's do this. So,
Oh, certainly. Okay. So the thing with being told you can be, a scientist, or you can be a surgeon, or you can be someone who cures something, that's an idea that's planted, but no one in my family at that point had successfully graduated from college. No one in my family had made it successfully past 1 or 2 years. So I had no blueprint.
yep.
So, learning to figure that out and moving forward after high school was not easy for me. I did go, like I said, to the University of Dayton. That was my first choice. And my, at that time, major was biochemistry. Well, guess what? Chemistry is hard and not too exciting like I thought it was going to be.
Yeah.
So I ended up changing my major to biology. And I go, you know what? I'll start here and I'll work my way up. I'll see what I like versus going through something that I knew was going to be difficult for me. And it turns out that biochemistry was not a field for me because I had no passion there. There was nothing that I desired to continue in once I got to those courses, and it became difficult. And I think a lot of times in our life, when we hit difficult things for the first time, they kind of knock us off our feet.
Yep.
Because we're not used to, I wasn't used to failing. I wasn't used to not being successful at something at that point in my life. So it was a wide eye opener for me, because at that point I lost my scholarships in college. And so I had to find a way to pay for college because my parents were not about that life. They
Yep.
raised me to be independent and successful, and not to have to depend on them. So I
Question.
joined the military at that point. Go ahead.
But before we hit the military, because I want to make sure I have an understanding. I know you had an idea and a direction in which you wanted to go into your profession. As we're sitting here talking about the major change, did you know exactly what you were trying to graduate with a degree for, like what job you wanted? Because I'm curious to know how that major change impacted your direction and the actual position that you may have wanted and ended up
Yes.
getting.
So, like I was saying, at that point, I thought that I wanted to work in a lab with discovering and research. But when I found out what kind of details it entailed and how isolating it really is, that turned me off completely. I have a heart of service. I like to be with people, helping people, and seeing the results of my labor in helping people. That brought me gratification. And that for me is an intrinsic motivator. So that's kind of how the paradigm shifted from being somewhere alone working to being working with people.
Okay, that makes
Does that
sense.
clarify it? Yeah.
Yeah, it does. It does. All right. So now that you're trying to get your money back so you can stay in school and whatnot, you join the military. Go ahead with that part of the story.
So when you join the military with no real guide or purpose, you start off as an enlisted soldier, which is a private. And so that's what I started off, private E1, bottom of the barrel. And then I got deployed. That was not a part of my plan, but it was a part of a higher plan for me.
Can
I have a
I
question.
ask, before you keep going, people here deployed all the time. I just want to make sure we have a clear understanding of what does deployed
Yes.
mean.
So deployment means you will be stationed overseas, so not here in the continental United States, but somewhere at a military base in another country for a set number of months to complete what's called a tour.
Mm-hmm.
And so that tour for me lasted about 15 months. But over that time, I was, like I said, a private. I did gain the rank of specialist at about 4 years in. I gained a lot of discipline and a lot of insight into who I was and what drives me. And I took a class called a combat lifesaver class and fell in love with quote unquote fixing people. That's not a medical degree by any means, but it is kind of an initial step for aid to give IV fluids, to splint people, cast them, to get them to the next higher level of care. You're like that first responder in that sense.
Yeah. That's interesting because I have a cousin who is actually a surgical tech. I know he graduated with his degree in nursing, and he wanted to work with the actual surgeons and did a lot of stuff.
Yeah.
He's also in the military, and he did a lot of stuff over there with that. And I'm just now realizing I never actually asked. So because so many people always talk about being deployed, I just picture everyone always working, the movies and stuff like that. When are you getting that training for this level of education? Like what? How does that even look? Like, is there a school when you're deployed that you get to go to and get additional training outside of, hopefully my wording isn't wrong, field work?
So yes, everyone in the military has a basic occupation. It's called a military occupational specialty if you're
Mhm.
enlisted. And mine was, believe it or not, a truck driver. That's another story.
Did you choose
Uh,
that or do they give that to you?
you get to choose. And the
Okay.
reason why I chose that, remember back in the beginning of my story, I just went to the military to pay for college. So I was trying to do the quickest job to go to training so I could get back home.
Yeah.
But we're not in charge of our plans. So I chose that job because it was the shortest amount of training, 6 weeks. So you
All
did
right.
basic, you did that training, and boom, you're done. You're a soldier. So overseas, or even here at home, if you want extra training in a certain area that's not your current military occupational specialty, you can go to a school. Some schools are 1 week, some schools are 2 weeks. A combat lifesaver is a certified course that's about 3 to 4 days so that you could get the extra skills to be that combat lifesaver. That's kind of like under a combat medic, which they go to school for about 6 months to be a combat medic.
Okay. All right. What is a combat? I heard you mention the things you get trained to do, but just
Yes.
for complete understanding, what does a combat, say that whole title
The
again?
first term was combat lifesaver.
Exactly. What does a combat lifesaver do? Because that name, I mean, the name is really extreme. So I just wanted
It
to know
is,
what
it
is
is.
the responsibilities of that.
A combat lifesaver is that first level of aid on the battlefield. If someone's hurt or injured, combat medics are not everywhere, just like paramedics here in the United States are not everywhere. So in the military, they train people within the same unit to be that first level of care to stop bleeding, to apply splints, to get that person stabilized. So it's a baseline stabilization role until a combat medic or a physician can arrive to treat that soldier. So I fell in love with that role.
Okay. All right. All right. So let's keep going up the rankings because I can see how falling in love with that role allows you to want to continue to build that skill set out.
So it did. So we came back home. We redeployed back to the United
Mhm.
States. And I'm not in school right now. And I'm trying to figure out, well, what is it that I really want to do? I already have figured out that I don't like biochemistry. Um, and I don't want to go back to the University of Dayton. So where am I going to move forward? Throw in a child at this point because I have my first kid now. So I have to figure out what do I really want in life and how do I balance what I want in life versus now raising a child as well.
How old are you at this point?
I am 21.
And you went to the military, sounds like around 20.
I joined at 19, turned 20, yep, deployed for that year and came back 21 and then turned 22 later that year.
All right.
And so here I am, 22, needing to provide for myself and my child that's coming, and knowing that I don't want to go back to school for biochemistry. So my aunt, who was already in school for nursing, my mom, who was an LPN, sat down and talked with me, and they go, well, you like people, you like the role you had overseas, why not become a nurse?
Mm-hmm.
And I got upset because I felt that that to me at that point was quote unquote an easy way out. Not that I was above being a nurse by any means. Nursing is an amazing profession. Obviously, I'm in the field, but I didn't want to do something because someone else told me to,
Touche.
and because I didn't choose it for myself. So it's almost like I had to see it that it applied to me and the way I could make it personal for me. I only saw one side of nursing, nursing home nursing. So my vision was very narrow when it came to that field. And to me, that wasn't a pretty side of nursing. It wasn't an enjoyable side of nursing. So why would I want a job? And I saw my mother. She didn't want to go to work. She had to go to work. And remember before you asked me if I loved my job. So I wanted a job that I could love, that I wanted to go to.
Yeah. And just you said LPN. I'm guessing that's what your mom was inside
Yes.
the nursing homes.
Yeah, she was a licensed practical nurse, which is the first or lowest level of nurse that there is in the nursing field.
Okay, so there was at least foundation in your life, and you were
Oh,
seeing
yes.
doing levels of healthcare, and
Yes.
that's tough. And I appreciate you actually acknowledging the truth, like you knowing and standing in your truth. Like I know what I like and what I want to do,
Hmm.
and that's why I need to assess this because I don't see that you enjoy that, and why would I
Yes.
want to take on something like that? And that's why the first question I have to ask in order to have the interview is, do you like your job? Because otherwise I'm just putting something out there. But as a person whose grandmother had Alzheimer's, and I recognize how needed those LPNs are,
Yes, they are.
man. Like those are conversations that are really, really close and dear to me because of my grandmother and how long she had to be with them and how much they depend on them. And like that is such a needed role. and,
Oh,
and,
it
and
is.
it's a strong person that can be able to go into those different places. I definitely want to just acknowledge your mom for that because
Oh, thank you.
yeah, I don't know where she was, but nonetheless, I've seen enough people who are doing that type of work, and it's not easy and it's necessary at the same time. So keep going. We
Well,
were
this is going to come full circle.
okay.
Just you wait.
All right.
So I still needed a job, right? I just came back from the military. So I decided, well, if I'm going to be in the medical field somewhere, that's where I need to start. I need to find a role that I enjoy, that I can see myself helping other people. So I went and took STNA classes on my own, and became an STNA. That was my first introductory role into civilian, because I used both terms interchangeably, military and civilian medicine. And all this time, I'm still in the military, but I'm still a truck driver.
What's
And
ST?
that's state tested nursing assistant.
Okay.
So there's different types of nursing assistants. There are certified nursing assistants, and they have a certain role that they can do. Some certified nursing assistants are not allowed to take glucose or take vitals. They just do the what we call activities of daily living. So grooming, feeding, those type of things, and basic cleaning are some certified nursing assistants. But as a state tested nursing assistant, I could check glucose, I could check vitals, I helped the nurses with their wound rounds. And after 2 years of that, a nurse pulled me aside, an LPN, so God bless them because they are saviors, especially in nursing homes, pulled me to the side and said, this role is not for you. I see greatness in you. I see better in you. I've done this job for 10 years, and I can tell you that you need to be doing something more. This is not where you are supposed to be. And I'm encouraging you to seek out becoming a nurse. You're too bright, you're too smart, you're so helpful, you don't complain. You need to consider going to school and becoming a nurse. And I go, oh, my mom's trying to get me to be a nurse. That is not what I want to do.
Mm-hmm.
Well, guess what? If people keep telling you something, it might not be you, it's the world, that's the higher power trying to draw what is already in you out.
Yeah. They see something more in you. And sometimes that's when people have to acknowledge, hey, you may not realize what's over here based off of your talents. So you may not be stepping into your truth without somebody pushing you like, hey, go look a little closer. You might actually see yourself in the reflection. Just for clarity, the STNA as well as the LPN, those are positions that you can acquire through a trades program.
Yes,
Okay. How
both
much
of them.
does that usually
Because
cost?
so some
No.
STNA classes, if you get lucky, are free. Mine were, but that was also 15 years ago.
Okay.
So most LPN programs, though, end up paying for themselves. They don't charge you. They'll like take it slowly out of your first few paychecks. STNA programs or CNA programs will be anywhere from $500 to $1,500, depending on who's in charge of their program and how they run it. And sometimes if you work for that company, your classes are free as well.
All
And
right.
so for LPN, that is a diploma/degree program, depending on what school you attend. So some are like vocational training centers that make you become an LPN, and those programs will be anywhere from $5,000 to $15,000. And other programs you actually do get a degree in, even though you're an LPN. And more schools are leaning towards that to make it a more of a profession versus a vocation and something that you're just going to do trade in. They want it to be recognized as a professional. Like you said, they are professionals. They are in those nursing homes day in and day out. Some of them are in wound centers. LPNs don't only work in nursing homes. They've kind of gotten out of the hospital, but they're in a lot of outpatient doctor's office, wound centers and clinics, dialysis centers sometimes, as well as nursing homes.
Okay. All right. Well, you just came into the realization, I want to become a nurse.
Yes.
What happens now?
So now I have to choose, do I want to go 2-year nursing or 4-year nursing? Why? Because at this point, I am 24 and my daughter is 2. And a 2-year nurse has the same pay and job as a 4-year nurse. The only difference is leadership training and management training. So at this point, I don't want to be a manager. I want to be a nurse. I like critical care. So I went to Bryant and Stratton. I did choose a junior college, if you will, because of time, because of I didn't want to be on a wait list, because a lot of other schools, Lakeland Community College, Tri-C, Cleveland State, they have wait lists for their programs. There was no wait list for this program. And I already had 2 years of college, so those courses would help me accelerate obtaining my 2-year nursing degree, which I obtained in 16 months.
Okay. And for anybody who's been watching, you've heard me mention Tri-C. So I'm going to, for those who haven't heard, Tri-C is Cuyahoga Community College in Cleveland.
Yes.
Got to be a fellow Clevelander. Got to be a fellow Clevelander. Makes me happy.
Yes.
All right. So keep going.
So then I started school in 2007 and I finished in 2008. And I obtained my associates in nursing at that time. And I took that to go become a nurse in the ER, which I absolutely loved. Nursing is a very rewarding career, but you have to be able to manage stress. So every day we deal with a multitude of personalities, with patients, with families, with coworkers, and different situations, a lot of high stress situations that we have to be able to process our own emotional reaction, as well as helping other people control their emotional reactions. So I found that role in the ER to be challenging, but fulfilling for me, because I get bored easily.
Yeah.
And I don't want to leave a job or change roles just because I'm not excited anymore. So I knew that going in about myself. So I refused to work on a regular medical floor, and I only did critical care at that time.
Wow. You're a tough person, and you're better than me. Before we continue to go, because I know we got a lot of positions here, I just want to make sure. I usually do this at the end, but I want to do it now. The STNA and those roles first. How much were those salaries, or what was the pay scale? What were you getting paid around that time?
So at that time, like I said, the year was 2006. I didn't mention that year that I became an STNA, but 2006 to 2008, I was an STNA, and I was making about $11.30 an hour at that time.
All right. And this current role that you're not your current role today, but I'm saying you're in
the nursing role that I was discussing.
Yes.
So at that time, this is 2009, I was making $25.74 an hour.
Wow.
Crazy how I remember these numbers, right?
That's with an associate's degree.
Yes, an associate's.
Nice. Okay.
Mm-hmm. And
Go
so
ahead.
I'm working in the ER, and guess what happens to me again? Remember, I'm still in the military. That job has not gone away.
So is this your second time or your third time? This is your second time getting deployed?
This second time. Yep. Okay. So that comes up again. And I'm like, oh, you know what? I love what I do. I'm going to come back. And the job that I had at that time began to put out emails and propaganda, if you will, that they were going to do away with that 2-year associate's nurse. And they wanted all of their staff to have the 4-year bachelor's degree. So guess what I had to do? Back to school I went. And I stayed local this time. I did not go away from home. And I obtained my bachelor's degree in nursing. But just as I described before, there's no real difference between a 2-year and a 4-year nurse besides that leadership and management role. So my pay did not increase just because I had a bachelor's degree, but the role increased. So I was able to take on more responsibility in that job as being a nurse at that time.
That's interesting. That the reaction that you've seen on my face was just a shock and a reminder that I remember coming in 07 in college. The conversation was just how oftentimes now something's going on in a professional realm where they're making people have more credentials than they previously needed to do the same job and get paid the same amount of money. So it's just interesting hearing you talk about that during that time period. And it just keeps happening. People are getting required to have college degrees for positions that frankly prior to they had skill programs.
And they were just
actually,
entry-level jobs.
Yeah, and trained you up to be able to do the exact same job without having to go into debt and being harassed by Sally. I got a restraining order with that woman. I can't stand Sally. She can keep her whole everything. But where was the deployment? You mentioned you got deployed, but you mentioned going to 2 year. Are you saying you got deployed and you stayed here?
I did. The unit went overseas, but because I had my second child, I stayed behind. But it for me was still a like home deployment because I went into the unit every day and managed the unit from home. So they were overseas doing a certain job and I managed the unit from home, which means I had to go into an office every day. I had to put on my military uniform. I had to talk with the commander while she was overseas, the first sergeant, which are the two highest roles in a unit. They are like the president and vice president, if you will, of a unit, a commander and first sergeant. They work together to run the unit. I had to help all the families of the soldiers who were overseas. I helped their families with any issues that came up, financial, housework, you name it. I was called a military liaison at that point. So that was a very interesting role because I was still connected to the unit. I talked to them every day overseas, but I handled the day-to-day like office runnings, and the soldiers who did not deploy, they still had a duty to fulfill. So I was in charge of those about 40 soldiers. So at that point, I became a manager, if you will, in the military.
And that manager role in the military definitely probably goes a long way to be able to say all the stuff that you've done. But we're talking about the time period. Right now, we're doing a Zoom interview that is getting recorded.
Yes.
I think we had Skype back then. Were you on the phone with these people or were you using video chat?
So there was Skype if I needed to reach them, but the connection was terrible. So now the connection is amazing. It's the same. You talk in real time like we do, but back then it would cut out, it would freeze. It was a nightmare trying to get information.
It wasn't fun. That's why I had to ask that. I'm like, Skype was horrible. It was new age technology, but it was horrible.
That was in 2011. So that was a tough year to get information. So we did a lot of emailing, a lot of phone calls. So I'd be up late because it's sometimes a 6-hour difference, sometimes an 11-hour difference. And I'm trying to coordinate things so that the unit can have what they need while they're there and prepare for when they come home.
Okay.
So all that time though, 11, 12, while they're deployed and I'm being this manager and full-time in the military now, I decided to go back to school, right? Because I had to get that bachelor's degree so that I could stay working for this company.
All right. And you were allowed to, because I'm only asking, are you allowed to? Because I know technically you were supposed to be deployed into another country and you were able to stay here due to circumstances. You were allowed by the military to go ahead and get an education while you were here at the same time? Or was it military that you got this education?
It was not through the military. They did pay for my degree because the military does offer a benefit. It is called the GI Bill. And some people are familiar with that term. They've heard it. The GI Bill is for active duty, National Guard, and reserve soldiers. And what it does is it helps you pay. It puts money towards a degree up to a bachelor's degree. And so I had earned that benefit because I deployed, and you get so much money per month with that particular, it's like a stipend to help you and a percentage of your books and a percentage of tuition that they pay. So I did use that program.
Okay. So it's not full ride, because that's what I was going to ask.
Oh, the Ohio National Guard does offer a full ride, but it's a two-trick pony, if you will. You use your GI Bill, and then they have something called the Ohio National Guard Scholarship Program. So those two programs together pay for 100% of state schools, not private.
All right, that puts it in context. I had a teammate who joined the National Guard while we were there.
Yes.
And okay, that makes sense now. All right, and UC is a state school, public school. Yeah. Okay. That makes sense. That makes sense. All right. So you graduated within the 2 years while you were being deployed at the same time?
I did. I finished my bachelor's degree.
Wow.
That was tough. I had, like I said, 2 kids at this time. I am married at this time as well, and maintaining everything else. Graduated magna cum laude, may I add.
What does
So
that mean? Because I've heard summa cum laude, magna cum laude, laude. I don't know anything. I don't know what those actual terms mean. Which lets you know, sorry, I didn't
that
graduate that high level. I did have above a 3.0 just for everybody listening, but I didn't dive deep into that.
no, that's okay. So different schools, private versus state, do have different grade point averages for those honors. So cum laude is that first tier of honors that goes up to about a 3.3, and then magna cum laude goes up to a 3.77, and then summa cum laude, summa meaning peak, summa cum laude is the highest, and that's that 3.7 or 3.78 a GPA and above. And I was so mad I graduated with 3.77, but if you knew my struggle, you would understand how excited I am to say that, because I'm not throwing it out there because I'm the best. I had a 0.83 GPA. I said that right, 0.83 at the University of Dayton, because I wasn't taking my studies seriously. So the military over these so 2003 to 2012, so it's about 9 years, gave me the discipline that I needed to set myself up for success and realize that time waits for no one.
Mm-hmm.
And if you want it, you have to be able to push yourself to achieve it.
I was really curious about that because I was listening to you talk. You have 2 kids at this time. You're graduating college. You're deployed. First off, where did you get the time? What is this secret sauce that the military may have given you? If it's that has a discipline to be able to even manage all of that. You're talking about managing people in the military. I can't fathom the type of stuff that you actually had to manage there when it comes to those people that are deployed, the type of conversations you were having during that time period, and have 2 kids at the same time while being here, taking on military duty in a foreign nation and having to study school. How is this possible?
My sister kind of asks me those questions all the time because every time she looks up, I'm adding something else to my plate. I'm doing something else. And I'll be very honest, very frank. Everything that I have done and accomplished in life, God has opened that door and He has given me the discernment to know how to prioritize. You have to be a meticulous prioritizer and you have to stick to what you say you're going to do. A lot of people, I don't know why my eye is just going crazy. A lot of people say they're going to do something, they say they know how to prioritize, but they get distracted. Their time management is not what they're saying that it is. You have to say that this is what I'm going to do today, write it out, put it on a post-it note, put it in your phone, PDA back then, everybody had Palm Pilots, and stick to it. But don't beat yourself up if you don't get it done that day. I blocked off my time, 8 hours for work, 2 hours for kids, 3 hours for homework, 1 hour for husband. I was going to bed roughly 11 p.m. midnight every night, and then waking up at 6 a.m. and doing it all over again. There's nothing wrong with blocking out your time when you have a plate full of things. Remember those divider plates we used to have back in the day where you put your vegetables in one and your food in a main dish in another, and then your starch in a third compartment? You have to do that to your day. I think we're just trying to wake up and just get through the day. That's not, to me, a successful way to handle busyness.
Yeah. Who taught you to do the time blocking? Because I want to say I've heard Elon Musk and I've heard a lot of other different people do it. I think Bill Gates blots out like either every 5 or 15 minutes. It's something crazy, but he knows what's going on every single moment of every single day. So who taught you that? Where did that come in?
So that's the military again, because we have a training schedule. And in that training schedule is a block of time for like instruction, a block of time for physical fitness, a block of time for food, a block of time for whatever the next training is. So you build that and you kind of adopt it to your life. And that's how you can you have to be so serious about blocking that time off. You really can't say it, and you can't let one block overlap the other. If this is the hour for this, that is it. And when that hour is up, you have to move on to the next thing. Otherwise, you just end up wasting your time because you're trying to finish that first thing. You'll get back to it.
Real question. How were you handling? Because I know people are hearing it, and it's like, it takes incredible strength. How are you handling actually not being able to spend as much time with your kids and your husband as you may have wanted to do? Like, how was that? Managing your emotions, managing your time, managing your mental health with the actual job. How did you actually pull that off?
That's important. And I had a general, a female general, the first one I ever met, ask me that very same question. When I took the job, I met her and she said, the job you're about to undertake stresses a lot of people out. They quit, they give up because it's too much. And you're a female in this role. I want to know how you are going to be successful. How are you going to manage your day-to-day stress? How are you going to continue to function when there's days that you know you're not going to want to do everything that you're doing? And I said one word, faith. And it seems like a cliche, but for me, it is not. My faith in God that He has everything under control is what drives me to continue every day in what I do. Reading His word, knowing that there's nothing that I can't handle, knowing that I can come to Him and open my heart and pour out those things that are bothering me. But once I pour it out, it's gone. I'm not carrying that into the next day. I'm not carrying stress or I don't do things. Some people, listen to music. Some people meditate. Some people go work out to relieve stress. That's the things that they do for their mental health. I throw on some of my favorite music that is Christian or gospel in nature. I read the Bible and I'm re-energized. I'm rejuvenated. And for some people that might not work for them, and that's okay. But you ask me, right, what works for me? And that is what kept me sane. My pastors and women's prayers groups, attending Bible study and being connected to other people of faith who can help hold you up on those days where you're not able to hold yourself up.
All right. That's all right. Because I grew up in a very religious household. Grandmother traveled and I had a whole lot. I was always vacation Bible school on weekend. Yeah. But at the same time, somebody was holding you up too. And yes. That's also important. Is like the faith and all that is great, but there's also people in the background. Even the pastor has other pastors holding him up when his knees is buckling. So that's what I was definitely looking for. And so I heard the different organizations you were part of, because some people need counseling if they don't necessarily have those connections, those resources. Right. Some people go to family. You obviously had the church, and you also went deeper into the church to the point that there were programs and real conversations that you were probably able to actually have with those people in those different groups of your part.
Yes. We have life groups at my church, and I make sure I stay connected to a life group. You can change life groups if you want, because they have different topics. Mm-hmm. So I definitely am always in a life group, because you need people. We cannot do this life by ourselves.
Humans aren't made to do this life by themselves. People always talk about independence, and it's like, there's nothing about our lives that are independent. We need our clothes that somebody else made and somebody else sewed and then somebody else delivered and somebody else like figured out the colors. Like it takes a whole lot of people in order for our basic lives in our first world nation to truly be able to operate the way that it does. And we oftentimes miss that. And even now, with everybody having the conversation, the kicks on mental health, people are recognizing the value and the significance of being able to speak with someone, even if they're not connected to you. I know that for me personally, one of the things that I've always tried to be a resource to my friends, as well as wanting other people to be a resource to me, is sometimes you need people that are far enough, but close enough to you. That's to the point, far enough from the situation that you don't have to worry about it coming back up, but close enough to you that you can trust opening up to them and being able to talk. And that type of resource and that type of value allows people to often operate. So definitely glad that you brought that up. All right. So Where are we at in this profession? We just graduated
So
college.
got my bachelor's degree in
Boy.
nursing now, right? Finished that second stint of duty, if you will. So that's the second step, or really the first step if you don't want to be an associate's nurse, to becoming a family nurse practitioner. You have to have a bachelor's degree in nursing.
Mm-hmm.
So at this time I changed, not professions, I changed roles in the nursing field. And so I talked about being in the ER. And so I changed to an outpatient clinic at this time because I had younger children, and the shifts at the facility or organization that I worked for were not working for me at that point in my life. And that's another beauty of the nursing profession, is that there is a niche for you. You do not have to be stuck working an 8-hour shift or a 12-hour shift or 3 days a week or 8 days a week. You can kind of find something that really works for you. If you want to work from home and be a telehealth nurse, guess what? You can do that too. And that entry level bachelor's degree does allow you to be in those fields.
Okay. What was the pay scale for that?
So I actually took a pay cut to go into outpatient nursing. But for me, nursing was never about pay. It's about satisfaction and liking what I do and wanting to come to work. So I did take a pay cut during that time. I was up to, I want to say $27 an hour at that time, because I was still building, pay raises every year as a nurse. So I was up to $27 an hour, and then I went down to $24 an hour during that time. Not saying that all outpatient nursing jobs are lower paying, but this was a facility that was ran by the county and depended on certain funds. So the pay scale wasn't what other people may desire.
Yeah. Did you learn anything in that position that you may not have been learning in your previous positions?
Oh, absolutely. I became certified in chemical dependency. So that added an extra skill set to my current nursing degree that I would have not been able to achieve in the first hospital setting that I was a part of, because they didn't offer any additional training besides critical care nursing or advanced life-saving, those type of courses. So this role allowed me to see a different side of people who needed help, and put something else in my tool belt that was going to make me more successful as a nurse practitioner, actually. I also got registered in the Drug Enforcement Agency, which also helped me as a nurse practitioner, already being a part of these programs and understanding one of the biggest right now. I don't want to use the word diseases, but the opioid crisis in our country is out of control, to say the least. And it gave me a different perspective, if you will, of that side of health, the mental health portion that's associated with the opioid crisis. And I actually started counseling in this nursing role. And a lot of people don't know that nurses can counsel, but they can. So it gave me a chance to explore a different side of nursing that I didn't have the time to do in the hospital, because you're so focused on your medications and your treatments and just getting through your 12-hour shifts. In this role, it was 8-hour shifts, but I had more face-to-face time to help talk to people and help them plan to be successful, as well as being a part of their treatment plan medically.
Yeah, I can only imagine that experience allowing you to be relatable with your current patients and the different situations they're coming to you with, that they may not have filled in the blanks, but because of your past experiences, you can ask the proper questions that'll lead you to the answers that you need to get their treatment together. So, okay. Now you're at outpatient. How long are you there? And then what's the next move?
So I was an outpatient for 3 years, but while I was there, I found that I wasn't being completely fulfilled. A lot of patients in that outpatient setting, I felt were getting poor care from their physicians because of the lifestyles they may have lived. And the doctors weren't taking the time to explain their medications to them, or the medications they were taking were not compatible with what they needed as far as their heart disease or diabetes or different other conditions that they had medically. They weren't getting the best care. So I got really just frustrated with the medical system. I go, you know what? I can do something about this. I can go back to school again. And my next step was nurse practitioner, because now I'll have that autonomy to have patients that I can treat, that I can help live better lives, healthier lives. I want people to come off of medication. That was my goal in being a nurse practitioner. We don't need all these extra drugs and things. If you teach people how to lead healthier lives and do health prevention, health promotion, you can reduce a lot of dependence on medications. Now, that's not saying that there are some people who don't have to have medications for their medical conditions. We understand that there is a need, but some of this extra stuff is just too much. And so
And
I
I
wanted to do my part.
Yeah. And I can only imagine the impact of working with opioids, like the people who are addicted to opioids and hearing people getting put on medications. Like a lot of opioid addictions come from just basic health care, providing them these medicines for a serious injury that they had. I mean, personally, I remember I fractured my L5 lumbar, my spine, for people who may not know what that means, when I was in high school, and they gave me Vicodin. And I have been using it for probably about, I was probably 12 days in, maybe 13. And I remember, it's so funny now as an adult looking back and not knowing what was actually going on with my body. But I remember talking to my coach. We were in Walmart, it was across the street from my school. And I'm like, hey, coach, like, all seriousness, like, I feel like it's something weird going on. And I'm like, hey, man, is gravity lighter these days? I'm dead serious. Like, I'm not joking. I'm dead serious. Like, is gravity lighter these days? He's like, he knows because I injured myself during running track. He's like, what type of medication do they have you on? I told him. And then my teammate, who actually, she was a discus thrower and she had tore up her knee a couple of times. She was like, yeah, we're not supposed to be on pills that long. The Vicodin, I don't think you're supposed to be on it that long. They had me in the street running around. We're just seniors in high school. Wow. And he's like, you're high. And I'm like, I'm high? He was like, yeah, you're actually receiving these certain things that you're thinking is going on. And I remember talking to people and not realizing that's what's going on with me. Like just looking at the moon and saying, hey, is the moon closer? And I'm talking to people about light, and no one's computing what's going on.
What's happening, right?
And you being a nurse practitioner, you experience these things, and like that's scary. Like I don't even really like pills now because like I didn't even know.
Want to get there.
Yeah, I didn't even know I was going through that during that time period. Even looking back, I'm surprised still as I talk about it. But okay. So you move on to working on becoming a nurse practitioner.
Yes.
I know when it comes to just getting your master's, getting your doctorate, getting any these type of higher level degrees, oftentimes there's a focus, a study, a research that a person does. Did you have that when you were in the process?
Yes, I did. Most master's programs make you at least do a research study, and doctorate levels do like dissertations. So for my master's research, because I did choose to go to school online, that's the beauty of, I think, our current society, is that you're not restricted to those hard buildings anymore when it comes to post-secondary education. So I did choose a school that had no wait list. Again, I don't like waiting for things. That's just who I am. So that I could get through my master's program. And my research study was based on cultural competency in healthcare. I feel that there is a huge gap for cultural competency, that physicians, nurse practitioners, physician assistants don't have the ability, because they don't have cultural competence, to pull in somebody's health beliefs, family beliefs, religious beliefs, and cultural beliefs into their healthcare plan, so that their plan will be more successful for them. If somebody already doesn't trust doctors, or, think about the Tuskegee, experiments, how are you going to get them to take this medicine? You tell them they need to save their lives. You have to understand the cultural significance that healthcare plays in our current society in order to help somebody else achieve what's called self-efficacy, which is the desire to really take care of yourself internally for yourself.
Yeah. Wow. And what did your research show?
It showed that there was a gap, and it showed where the gap was. Like, it went by nationalities or ethnicities, if you will. And believe it or not, the biggest gap is not with African Americans, it was actually with Asian Americans, because they have a different philosophy in Eastern medicine. They don't always follow traditional Western medicine. So there was a huge gap as far as health disparities in treating Asian Americans. But there is still a gap with African Americans, with Native Indian Americans here, with South Americans, because they just can't pull doctors, physicians, and nurse practitioners were lacking the ability to pull their culture into the healthcare, which means you acknowledge the culture, and you tie it together.
Okay. Being Black, myself, and obviously you as well, I have to ask, what are, and you mentioned Tuskegee experiments. I'm very cognizant.
You'll have to cut that out.
You're good. You're good. I'm very cognizant of the fact that, of course, the Tuskegee experiments, all different things that happen to us in the Medicare medical profession. But frankly, unless you actually did that research, unless you really looked into it or had somebody educated tell you about it, I don't see, I mean, I learned about the Tuskegee experiments in college. So what's really allowing it to persist with us? What's causing that gap with us if we don't necessarily know about all these extra things that took place with us in the medical realm?
Because just like we talk about like generational curses and generational blessings that we might discuss that happen within our, homes and communities, that distrust has been passed down.
Without
We might
understanding.
not, without understanding and knowing why it happened, the distrust has still been passed down. You hear older women or men, I'm not going to the doctor. The doctors, I can do all this stuff myself. I don't need a doctor to tell me what I already know, because the distrust has already been built there. So that's why we have to educate ourselves.
How did you, or how do you address that? I know you mentioned addressing culture, acknowledging culture, but in doing that, how do you make it real? Because I just want, especially if somebody's listening and they are this person, I'm just curious, how do you get them back to the other side that you'll be able to treat them and help them improve and increase their life experience?
I tend to try to relate the best to my patients, and I call it meeting you where you are. So I have to find out what you believe in healthcare first, why you have any distrust or why you think something may not work. And then I explain, I feel, on a relatable level on how this particular medicine or treatment or regimen is going to benefit you now and in the long run. I discuss why it's not going to benefit you if you don't take it or if you don't follow through, in a way that's just more real, more personable. I do use either myself or family as examples, divulging just enough information so that people know that I'm speaking from my own personal experience, not just telling you something because I read it in a textbook. I think when you can relate to your provider in a different way, on a different level, then you have more trust, more respect for them. And that's what I try to build. Before I even start telling people about medications or treatment regimens, I try to build a good rapport. That is so critical to a successful relationship, like patient-provider relationship.
Absolutely. I know I've easily let go at least 2 or 3 different doctors because I was trying to find me a personal one, and it seems like they just didn't care. They were just coming in with the lack of understanding or even care in the conversation. So you just graduated and got your, it's not the doctorate, your master's. Okay.
Yes.
You got your master's in nurse practitioner.
So it's a master's of science in nursing. So all of my degrees are sciences in nursing, associates, bachelor's, master's. And when you choose to become a nurse practitioner, you choose what's called a tract. So you choose to be a family nurse practitioner or a geriatric, which means you deal with people 60 plus, or a pediatric, which is under 18, or you do acute care, or you can choose cardiology. I want it to be, for lack of better terms, marketable. And that's important when you choose roles with higher education, because if you're not marketable, then you might have wasted 2 years that it took to obtain that master's degree and to get into that profession. So a family nurse practitioner is more marketable because I can work from birth to death. Wow. That's my age range that I can treat as a family nurse practitioner.
How many years does it actually take to become a nurse practitioner?
So there are traditional and non-traditional ways. I'll discuss the traditional way first. So traditional is you go to high school and you go to a 4-year college and you obtain a bachelor's of science degree in nursing. If you desire to go higher in nursing, you want to treat patients, you want to write orders, and you want to order tests and interpret them, you go to be a nurse practitioner. That will be a master's degree, an additional 2 years. Most programs prefer that you've had at least 1 to 2 years of baseline nursing Why? Because you need to understand medications. You need to understand patient assessments. You need to understand how to interpret what you're reading. And it's not easy to do if you just go straight from your 4-year degree to a 2-year degree. You need to absolutely have that hands-on experience applying what you learned as a nurse and building up your baseline level of knowledge before you go to pursue that post-secondary for your master's degree. So you can get it in 6 years. You absolutely can.
Uh-huh.
And you can do a non-traditional way, which is what I did, because I did 2 years at the University of Dayton. I did a 16-month RN program. I did a 1-year bridge BSN, bachelor's program. And then I did a 14-month MSN, master's program.
But your route, although it was non-traditional, it also came with a whole lot more experience. From based off of what you just told me, it sounds like you acquired a lot more certifications as well as a lot more experience that helped you when it came time to graduate from grad school with this degree. Is that accurate? Like you may have taken a longer route, but you actually received a lot more qualifications for your role.
Yes. And I noticed, because when you're in a virtual environment, which I was, like I went to school with my master's online, you meet a lot of people from across the United States. So nurses at every level. Some have been nurses for 2 years because that was the minimum requirement. And some have been nurses for 20 years. And I felt that I was very well prepared for my program with the experience that I had from working in the hospital, from working at the outpatient clinic, the CLS training I received in the military. All of that together made me very prepared to handle the master's program.
Okay. All right. I smirked earlier because I have to ask. Every time we're in the doctor's office, oftentimes, especially with the x-ray, you get an x-ray, and I know it says it's your job, but when people get x-rays, they're like, so what you see? We got to wait till the doctor come in. You know, you've seen nothing but x-rays all the time. You know what you're looking at. So just out of curiosity, I mean, we're in a situation where you're not telling me something about my health. So I'm just asking a genuine question. What do you all actually know? Well, obviously you're a nurse practitioner, you're way higher up, but those nurses that come in before the doctors, because you don't come in with the doctor, you have your own actual practice and your own clients, and I understand that. But those nurses that are coming in before the doctor comes in, they're talking about the medications. Do you all, and when they come back and say the doctor says, this is the prescription, here's your script, do you all tend to actually have an understanding a lot more than what's being told? And if so, why is it that you're not allowed to reveal that?
Oh, that's the easy question. So the answer is yes. Of course, we have to know, because we have to be able to explain what the medication is for. We've already had a conversation with the doctor, prior to coming in. But there's a liability. A nurse cannot diagnose, so they're not allowed to tell you, because that's outside of their scope of practice, and they could get themselves in trouble for saying what's wrong with you, because then you're going to have questions, and those questions are not for the nurse to answer, they're for the doctor. That's why the doctor has to be the one to come in and explain what was seen and what the treatment plan is going to be. But the nurse comes back and provides the education, right, in the discharge instructions, because that's part of our role, is that education of the patient.
How frustrating is that for the nurse to not be able to answer that question?
Some nurses have a hard time with that, because they get told over and over again, nurses don't diagnose, nurses don't treat. Like, you get that ingrained in you. And for me, that's why I went on to school, because I'm like, okay, I can do what you can do, and I'm going to.
And I'm glad you said that. I've gotten some exposure to a nurse practitioner when I needed to go to the hospital. I think I was dealing with something. I had to go to the hospital, and a nurse practitioner stepped in, and I was like, where's the doctor or whatever? And they're like, she does all this stuff. So from my understanding, a nurse practitioner sounds like it's like a step under a doctor, but you all can do a whole lot. I initially thought that you all can prescribe medicine, but then I found out you all can do that too. So create some clarity about what the difference is, what the responsibilities are of a nurse practitioner compared to a doctor.
I will be more than happy to, because this is where I get to highlight all the wonderful things we do. And I will preface with this. I know that we are not doctors. We are not trying to be doctors. We want to be nurse practitioners. So what the nurse practitioner is considered in Ohio is a mid-level provider. So above the nurse, under the doctor. We have a lot of autonomy, because we do not have to work in the same office as a doctor. Physician assistants do. We could work in our own building, have our own patients. We just have to collaborate with the doctor, which means we have to be able to pick up a phone and call a doctor and say, hey, I have this patient. This is what I'm thinking. What are your suggestions? And they review our charts. So I'm allowed to diagnose. I'm allowed to write prescriptions. I'm allowed to treat my own patients, especially with not very serious health conditions. So your basic high blood pressure, high cholesterol, diabetes patients, basic musculoskeletal injuries. So when they get to have more complex or their diabetes or high blood pressure is so far out of control that I need additional help, that's when we refer and collaborate with physicians, because they have that extensive training, above what we do, to be able to kind of dive into the problem a lot deeper. We send them to specialists. I do write a lot of referrals for people to go to specialists for things that I know are out of my realm. And I think a lot of physicians are afraid that nurse practitioners are trying to step into a role that they're not ready for and work outside the scope of practice. But most nurse practitioners already understand there's a limit. Mm-hmm. And we respect doctors because we need them. They are the experts. They are that highest level. But there's nothing wrong with a nurse practitioner that has some of the knowledge that a doctor has to be able to handle those not as severe cases of illness.
Okay. So I want to know what's the severity levels that you actually can cover? And I also want to acknowledge the fact that as a person who's went to a doctor enough and got frustrated with not being able to get answers, it seems like they refer a lot too. Respectfully. It's like they refer a whole lot. And my doctor guy that I had on here, one of my friends he's done an interview with me, yeah. He actually was talking about how, we have our specialties, but then, when it comes to the ear, when it comes to the heart, those are the people who really lock in and focus solely on that. So you need to refer. So when you're saying you're doing referral, I don't hear a major difference here in that statement, because it's necessary for doctors to refer, because I need somebody that truly understands this knee issue that I may have that can step in and say, this is how you're going to get it completely back to normal.
Yes.
So what's the severity levels that you can cover compared to a doctor?
So I don't think there's not a textbook answer for that. Okay. So nurse practitioners typically treat people who are more stable. So by stable, with blood pressure. So high blood pressure, I'll just give you a general number. Anything that's like 130/90 is considered like hypertension. So when people first get diagnosed with high blood pressure or hypertension, we should be able to treat those patients. But if we find that one medication or two medications is not working, their blood pressure is still elevated, there may be something else going on underlying that we can't get a hold on. So we need to collaborate with physicians to make sure that that patient is getting the proper care. Everything isn't, as clear cut and dry as we would like it to be in life. So we find that when it's not manageable, that's the best thing I can say to make it make sense. When we realize that this basic health condition cannot be managed with the level of care that I'm providing, I need to call in the physician.
Okay. All right. Huh. Well, I'm curious now, because as you're talking about this, of course, we want to talk salaries. What's the salary range for your current position?
Okay.
Like, what's the salary range? This is your current position. I'm cutting you off because I don't want you to say every other time you were out of those positions. So I was comfortable with you saying a price tag. I don't want to know your exact price tag. I want to know.
Okay, you want a range.
What's the range for your current role, especially because you can have your own practice. You can have your own facility. You can be operating and doing your own practice. So what is that range?
So entry level is right around $90K. I have been a nurse practitioner for 5.5 years at this time. So that salary range generally is about 110 to 150, 100,000.
Yeah. Okay. And when it comes to, because my friend who's a doctor, he kind of made me aware, it's like, big cities, you don't get paid a whole lot because there's so many of you. But if you go to a smaller town, because you're the priority and you're the primary person, you can easily make a whole lot more in a smaller town. Is that the case for you as well? Like if you were to go to Youngstown, I don't know how small Youngstown is, I've never been there, but a smaller, no disrespect Youngstown, if you go to a small town or whatnot, would you be able to have a higher pay than 150 at the top that you mentioned?
I think that for nurse practitioners, that is not true. The reason why is if you have to bill, which is called fee for service in our like for lack of better terms, profession, fee for service, we don't get paid what physicians get paid. If
Mhm.
physicians got paid $100 for every hour, we get paid 85 for every hour. So if we went out somewhere in a more rural area where there weren't enough practitioners, and people don't necessarily always come out to see the doctors, we would have less patients. So we would get paid less because we get paid less per hour. Whereas here in a city, there's still enough patients to be seen that you can still make that money. And also, nurse practitioners do better, I think, when they work for corporations. So I work for a Fortune 100 company.
When you work for the corporation, is that it's better because you have access to more resources, or okay? Because I
They
know you
cover
said
your
the work.
malpractice insurance. If I was on my own, I have to pay for my own malpractice insurance. But because I work for a corporation, they pay for that.
Okay. And so you answered the question whether you work for a large organization or smaller practice. Do you have, well, we're not going to touch that question. I like to keep people in enjoying their job, so I'm not going to ask about having your own personal one. But if you did have your own personal one, you could potentially make more, but take on more risk.
Yes, it absolutely is taking on more risk. But I have patients right now that ask me all the time, when are you going to open your own practice? I will bring myself, my mama, my cousin, and my kids. So forgive me for taking on my professional hat. Sorry about that. But yes, I would love to have my own practice and I could still make what I'm making now. Absolutely.
Okay. All right. You said something a little bit further back, and we're going to get to rapid questions after I say this. And I
Okay.
definitely want to hear your perspective because you said something that really hit home with me. And people who know me, my mentors have got frustrated with me for this. And as an adult, sometimes you realize that you've been told things throughout your entire life. And then you finally ask, what the heck did that mean? So for me, it was always patience is a virtue. Patience is a virtue. Patience is a virtue. What's a virtue? Like I didn't even like now as an adult, I know what a virtue is.
Oh, okay.
It's a
I was like, I'll
quality.
break it down.
But I'm saying people saying what's a of course religion. I got you, super religious. I got you, Christian and everything. But when we're talking about patience as a virtue, they were saying this to a freaking 10-year-old, a 9-year-old, a 7-year-old
Hmm.
without actually explaining it. And I didn't understand it. And now as an adult, I remember somebody saying that to me, and I finally was like, it ain't my virtue. Sorry. Got a lot of virtues. It ain't my virtue. And it's upset my mentors, but I will say that it is
Right.
my virtue. I'm very patient. I'm extremely patient. I'm patient beyond what I want to be. And I recognize that when I'm hearing patience, my frustration is what you said. Many times people are using the word be patient when they really mean wait. And the difference between patience and waiting is, say somebody's wife is pregnant, you have to be patient on that baby developing and it coming out when it's going to come. You can't do anything to speed that process up. But if you have an injury to your knee, you don't need to be patient on the recovery beyond the actual time period in which you need to obviously let it heal. But when it
Hmm.
comes to the therapy, you need to actively be doing things to allow it to get stronger. And if you're not, then you just waiting for something to heal, and it may not heal correctly without the proper
Right.
actions taking place. And so for me, my frustration is people saying be patient, and they really tell me to wait on something I can be proactively doing. And when you was like, people keep telling me to wait, and I don't like being told to wait. And it's like, that's my feeling too. It's like, you can
Hmm.
be doing something right now. The things that you can't do something about, that's what you need to be patient about. But you're not telling me to be patient. You're telling me to wait when you could be doing something during the time period that time does need to pass in order for this
Exactly.
thing to be finished. I'm sorry, it was a soapbox sitting on the side. I had to
That's
grab
okay. But people need
it.
to hear that to understand. Just because you're being told to wait doesn't mean you don't have to sit down and do nothing, right?
Mhm.
Make the best of your time. Don't let it be idle. Don't sit around and quote unquote wait for something else to work out. You can be working on things to help move yourself and progress yourself.
Yeah. And I think it often came up for me because people say, and I remember seeing the quote a lot, be still and know that I'm God. And it's like, for me, whenever I've heard it, especially in actual context, it's like, these are things that are beyond your ability. So that's patience. That's the things that you can't do. But there's also that story of the person on top of the roof during a hurricane or a flood is out there,
Yeah.
and the boat keeps coming by, like, hey, you want to come up? Nah, we're good. And then he gets the guy and he's like, I sent you 3 boats.
Yeah.
I gave you options to be active, but you were waiting on me to do something. But yeah. We went down the path that I was enjoying for a second. So
No worries.
Okay, before I do the rapid question, I have one more thing. We talked about medications. And my thing with medication is, and I appreciate it, so I definitely want your perspective on when a person should be using medications long term, and when should they actively be doing something to not have to use those medications long term. And if you have any actual examples in which people are using medications long term, and they don't have to, it would be great to hear that. Because, perfect example, personal testimony, I take medication. Not take medication. I take vitamins and things like that just to like stay strong, turmeric, those type of things, a little bit of inflammation or whatever. So that's not really medication, but I decide to. I don't like to have to. And as a person who initially had like high cholesterol, I heard this and they was like, yeah, we're gonna test to see if you can, if we're gonna put you on a timetable to see if you're gonna get put on the medication. I'm like, I'm not responsible to have to take a pill every day. It's a difference between doing it and having to. I didn't want to do that. And so I actually was able to lower my cholesterol, I want to say like 70 points in a matter of 6 months. And that was that moment, was like, I'm not that guy. And I also don't think that we have to live like that. So that's why I'm asking that for context.
Yeah.
So if you could definitely talk about the medications and when a person should, like I was saying.
So absolutely. So I'll keep it simple. And I'm kind of in that same boat. I have genetically high cholesterol because for years and years and years, family members not taking care of themselves have passed that on. We have bad eating habits in African-American culture. We already know that. So similar to you, I was like, I'm not taking any medicine. You're not going to get me to take one single pill. I will prove to you that I don't need medication. So you ask, what should people be doing? What could people be doing to have to prevent? And prevention is the best thing you can do. You don't want to have to need a medication. So there are people who go to the doctor. So first of all, you need to go to the doctor. You have to know your numbers. If you don't know what's going on internally, by the time you get to be 50, 60, and your body's telling you to go to the doctor, now you're at a point where it's too late and you need medication to correct the health issue that you have. But if you start going to the doctor in your 20s, in your 30s, knowing your numbers, catching things sooner, you can start to have lifestyle changes, is what they're called, to prevent needing medications. So things like diabetes, preventable. High blood pressure, preventable. High cholesterol, preventable. And lifestyle changes that you can incorporate early on will reduce your need for medications in those fields. Yeah. So learning how to have a high fiber diet, eating complex carbohydrates versus simple carbs. So your simple carbs are your white starches, breads, rice, potatoes, changing to complex carbs. So you're eating cruciferous vegetables, which is your broccoli, your cauliflower, your asparagus. You're adding nuts and beans to your food regimen to help increase internal fiber and reduce your body, because it already produces cholesterol on its own, doesn't need any help from your diet. So when you eat those high fiber foods and those green vegetables, you're pushing out that bad cholesterol, and you can drop your points on your own, including plant oils. So cooking with canola oil, cooking with olive oil, changing how you eat, increasing your exercise, and sleeping properly does wonders for people. And you mentioned turmeric, garlic, ginger, curry. Those spices are natural anti-inflammatories that will help reduce inflammation, help reduce glucose. So incorporating those things into your cooking habits can reduce dependency on medication later on. Now, I've had patients that have been put on oral medications for diabetes, oral medications for blood pressure. And when I work with them to help them change their diet little by little, increase exercise, they've come off those medications. Those diseases are preventable and treatable without medication, but you have to be diligent to do what's necessary to cut out some of the things that aren't really good for you, just taste good and are fun, and give those up, even for a short time, because all things are okay in moderation.
Yep. I appreciate that. I appreciate that because for me, I remember hearing someone say it and it really triggered me because I've been black. You have diabetes in family, you have heart disease. I mean, a lot of men in my family, like it's a lot of different things that run in quote unquote families. And
Yes.
that is that right there that has always bothered me, especially after I heard someone say, it's like diabetes doesn't run in your family. It's the fact that you're eating habits that create diabetes. Now I'm not talking about type 1, like
Right.
type 2 and those type of things like that. That don't just run in your family. It's your habits that are allowing everyone, you all have the ingredients and the instructions to perfectly get diabetes over here. Do this and you get that. And you're not changing that in order to avoid that. And once you change it, it doesn't have to be a part of your reality. And I appreciate when people acknowledge that, because it's like people make it seem like it's just like, yeah, you're gonna get it. No, you can do things to avoid it. Yeah. And so I definitely appreciate that. Let's get to the rapid questions. So the rapid questions are exactly as it sounds. Be as concise as possible. If you need to articulate something, go ahead. And yeah, all right.
Okay.
Ready?
Yes.
First off, softball all the time, which is favorite sport.
For me, it's basketball. I've loved it since I was a little girl. I played it till I was in high school. I like the teamwork. I like that it's shorter field. Football is too much going on. But yeah, basketball.
Favorite book?
Ooh, that's a good one. I'll probably have to say there's a book called The Atlantic Gene. It's a sci-fi novel that incorporates real science, but a lot of fiction as well. And it's about how the human genome has changed over years. And at one point, there was like this, just kind of like a big bang, but not in the universe, but in our genes that helped us go from being Neanderthals to the formal, like smart humans that we are today. That always has interested me.
Okay. And that, of course, that makes sense. Favorite hobby?
I love to bake. I make like designer cakes.
Oh, okay. If you could speak with anyone, dead or alive, not related to you, who would it be?
Not related to me, dead or alive. Oh, this is one of those questions I don't think I've ever really thought about, because it's like a philosophy question. I'm not a philosophy person, just being very honest. So I don't know if I have someone.
Keep it low level.
Okay. So Michelle Obama, I would want to know from her perspective what it was like in the White House, what it was like once, especially during the second term, not the first term. The first term was probably pretty new, establishing who you are, learning that role of the first lady. But during the second term, where there's more turmoil in the world and in our country, like how did she, from her perspective, handle that role?
All right. Now, this apparently is like the hardest question I keep asking everyone. So I'm trying to give you all outs to make it easier. So if it's too hard, I'll figure out to give you an out. So the question is, and keep it within profession, not too personal. What is the song? The out is the album that may be your story, or what song is it that's connecting with you? What's your testimony?
Probably Never Would Have Made It.
Okay.
And that's plain and simple.
Yeah. Not leaving the company. What's the dream position?
Oh, I've tried already to apply and I didn't get in yet. That don't mean I'm giving up. So my dream position is to move into our education team and be the lead manager for that team. I want to really work on helping people see the value in staying with our company. We have a high turnover because it is stressful to do what we do, because we have so many mandates from Medicare and Medicaid that we have to hit. So if I could work on that education team and find a way to get people to believe, right, in what they do, as well as the vision for the company, I think that would be my ideal position.
Okay. What's the change you want to see in the world?
I don't know if it'll ever happen in our lifetime, but as far as in the world, I would love if people could have you ever heard treat the janitor like you treat the CEO?
That's the only way I know.
So that's what I want to see. I want to see people stop looking down at someone because they're not where you are, because you don't know their story. I want you to help that person, right? Up if you have something that they could use to better themselves. Don't hold it for yourself or a certain class or group of people. You treat every person the exact same. And it's not the way you want to be treated, because that's easy to say, treat people how you want to be treated. No, treat them how you treat that person that's got all the money that you think is going to change your life. You treat everybody the way you treat that person.
I love the platinum rule, which is, I mean, you got the golden rule, treat everybody the way they want to be treated, the way you want to be treated. Platinum rule is treat people how they want to be treated. Like,
okay, yeah.
I may not want to be treated the way you treat yourself. I want to be treated the way I want to be treated, and learn that and treat them that way. That's definitely something I connect with. What's your why? You've mentioned it a couple times, but I'm just curious to hear how you articulate it in this situation.
Okay, my why. I want people, when they are done interacting with me, to remember me for the rest of their lives and not for something negative. I want to leave a legacy with every person that I interact with. And that might sound crazy to be able to do, but it's possible. I come back and talk to people I've run into from 5-6 years ago. I never forgot you and how you treated my mother, or how you explained that to me. I've had somebody tell me, when I recommended something, I said, hey, tell your doctor X, Y, and Z, you need this, 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 and this, but you didn't hear it from me. And they came back to me 2 years later and told me I saved their life. And I caught something that their doctor didn't catch. So that's my why, that I am daily affecting people in a positive way and change their lives such that their trajectory is never the same after they meet me.
All right. Well, that was the entire questions of rapid question. I definitely appreciate that.
Okay.
I have one question outside of rapid questions that should have came before that I really wanted to know. When you mentioned your pay scale, you're also still active in the military, correct?
So that pay scale did not include my military pay.
And that's what I was getting at. So you get paid twice.
I do. We didn't finish that story. We left off at the deployment. So what happened was, when I got my master's, I didn't want to be a truck driver anymore. So I'll speed this up. I did what's called a direct commission. So I switched over from being enlisted. I made it all the way up to staff sergeant, which is not always easy, which is an E6. So I was an E1, made it to E6, changed over to being an officer. So that's why I'm a major now, because I'm an officer in the military, as a nurse practitioner in the military as well. So that particular pay scale can, because of my rank, and I'm part-time. Remember, I'm not full-time in the military, I'm part-time. Okay. So it's an additional $30,000 to $50,000 a year.
That's not bad. No. That's not bad at all. Okay. So did that wrap up that story with the military, just for the record?
It did, just so that people know that I didn't just stop at that level, that I switched over, became an officer, I'm a nurse practitioner, and now I command a medical unit in the military.
That command, is that off? I'm assuming that's completely disconnected from your day-to-day job, but are you doing that every day as well?
Yes. Okay. So I technically have, even though I am part-time in the military, when you're a commander, that is not a part-time role, because you are managing a unit. So I do that full-time. So I might have meetings for my regular civilian job, and then I have meetings for my military job. So I am balancing those, as well as still the 2 children and the husband.
Okay.
And I'm a Zeta. Did we mention that? Probably didn't mention that. Left that out of the story.
Oh, it was gonna come up. It always comes up. Don't get it confused. Yeah, so that she's one of my sorors, if you all didn't recognize or catch on to that. That's a sister right there. I have to ask the question of, and I'm gonna edit this little pause because I spaced for a second. Please go ahead and tell me about the retirement situation, because I know that there's some people, it's a good retirement situation from the military. So you've been there over 10 years from what you just told me. What I've listened to, you've been in the military for over a decade.
Yes.
How much longer do you have to be in there until you can retire?
So I, in about 5 days, so 5 days is the 16th, right? So in 5 days, I will hit my 18-year anniversary serving in the United States military. You have to do a minimum of 20 years in order to collect a retirement. So I am 2 years from the minimum requirement. in the military at this time. I will do an additional 10 years past that commitment to 30 years because my overall life goal is to retire at 50. And that's not just the goal. I'm going to make it a reality. I will retire at 50. I will not work for anyone. I invest. If people are not investing in the stock market, you need to be. And as well as having, 401ks and military retirement. So that's my retirement plan.
Okay, I appreciate that. That's definitely what I was looking for. Okay, so we had a really great interview. I've enjoyed all of this. I want to know, what is it that we may not have gotten to say? This is your takeaway. What is it that you may have wanted to share with our audience that may not have come up in this discussion?
That I want people to realize that sometimes setbacks or detours should not discourage you. I think they help build character and they help you understand what perseverance is. So not everybody's going to have that clear-cut straight path, right? Like you said, people tell you all the time, you can be anything you want to be when you grow up. Well, what does that mean? What direction am I going in? How do I find my way? So I would encourage people to find paths that align with their passions. So really take time to know yourself. Don't know what other people know about you. Take time to know yourself so that when you find that passion and desire, you already want it. So it's going to be that much easier to obtain it.
Okay. What is the thing you would tell your younger self that would allow you to be successful quicker? Because obviously you're successful. From everything I've heard, I hear a great level of success. But what would you have told your younger self that could have allowed you to get into your current position faster?
Oh, I just wish I would had the discipline that the Army taught me. If there was a way to put that in front of join, I still would love to join the military. I probably would have joined the Air Force though, I'll tell you that much, because their deployments are 3 to 6 months. And it's just a totally different service. So I would have joined the Air Force and I would have told myself just that diligence is the key, and to reach out to people. Do not try to do this on your own. I tried for years and years and years, like we already discussed, to do things myself, to be that independent person, and I met more obstacles that way. When I actually started connecting and networking with people, life became so much easier.
Yeah. All right. I really appreciate you today. And I've taken away several things from our discussion. And the first thing is, know your blueprint. There was something you mentioned earlier on, and it's something I always talk about. I mean, success leaves clues. This is a clue right here for everyone. I'm bringing people who have been successful in things that you could acquire. This isn't making it to the NBA where it's 1 in a million chance. She told you exactly how you can become the next major Dorian Marsh, and take that clue. Find your blueprint, follow your blueprint, but you also really continue to stress the significance of passion, having your passion, being true to yourself. And in that, you're learning, you're growing. You even acknowledge the fact that you took a step back, but even when you took the step back, it was bringing more value. And that's why I asked about learning. I'm always push this for everyone that's used to hear me saying, if you want to earn more, learn more. You were talking about, I went back and learned more, which allowed me, frankly, to go off and discover something that was going to allow you to earn more throughout your life, and as well as the skill sets, and become more valuable in building up your why for the value that you're helping with your customer. So I definitely appreciate that, not your customer, but your patient. But I also really, really appreciate the stress of be true to yourself. In life, we get this one shot. If you're true to yourself, life will be a lot easier, opposed to a lot less regret, because you're looking back like, I could have done this, I could have done that. It sounds like you're doing this and that to get you the life that you deserve and the life that you want. So definitely appreciate you and your time. More importantly, also thank you for your service, and like that, to it is.
All right. Thank you. Take care and enjoy the rest of your day.
Ooh. that was a lot. I appreciate you. Thank you.
Oh, it's no problem.